pediatric pneumonia. It is an infectious disease of the lower respiratory tract caused by the pathogens and also the non-infected particles. It is the inflammation of the terminal bronchioles and the alveoli, air sacs which are responsible for provision of the fresh oxygen to the blood and the exit of the carbon dioxide from blood to the exterior. So the function of the lungs are to purify the air and provide the fresh oxygen for the vital capacity of the organs. So in this disease, the pathogens, they get entry through nasal and the oral cavity, through the airways up to the air sacs. That produces the inflammatory process, the protective system of the mucociliary of the bronchus and the bronchiole, they are damaged by these infecting organisms, and they produces inflammation, due to which there is overproduction of the mucus. So plugging of the mucus, that also produces obstruction in the passage of the air during inspiration and expiration. It is of two types: community acquired pneumonia and hospital acquired pneumonia. Virus is the most common pathogens which affect the children under 5 years old. That is, the severity of the disease in viral pneumonia is less virulent as compared to the bacterial one. Various viruses, that is respiratory syncytial virus, adenovirus, rhinovirus, influenza and parainfluenza viruses. These are responsible for production of viral pneumonia in the infants and the younger and older children. Whereas the bacterial pneumonia is caused by the Streptococcus pneumonia, Mycoplasma pneumonia, then Staphylococcal aureus. These are the various bacteria which produces inflammatory changes in the terminal bronchioles and the air sacs, which produces consolidation and reduces the capacity of the lungs parenchyma for their normal gaseous exchange functions. Due to inflammatory process by the reaction of the immune system, which come as a defensive mechanism against the pathogens, that is virus, fungus and the bacteria, there are production of cytokines. These cytokines, they produces inflammation. There is accumulation of the macrophages and the other defense immune system cells, B cell, T cell, and then there is production of the exudate and the fluid which fill the air sacs, and they subsequently they are converted into the purulent fluid, that is the pus formation. Due to this process, the function of the air sacs to exchange the gas is reduced. They become solidified, and that is called as the pneumonia. That is, the function of that portion of the lung parenchyma is reduced. They are solidified temporarily unless it is treated by the medical and the surgical procedures. So this is the mechanism by which pathogens or the infection that produces consolidation of the lung parenchyma, that is the pneumonia is produced, whereas the non-infecting causes are food particles and the foreign body, they get entry into the respiratory tract, and that produces the irritation, inflammation, obstruction due to overproduction of the fluid and exudate that block the passage of the air in the airways, that is bronchioles, and also they are accumulated in the air sacs or the alveoli, and they produce fluid. They become filled with fluid and their function is lessened, and the supply of the oxygen to the body is decreased. That is, there is hypoxia and hypocapnia, that is, the level of the oxygen in the blood is decreased, whereas the level of carbon dioxide increased in the blood.